Actually, almost everyone who needs some form of teeth straightening can definitely qualify for clear aligners. So clear aligners are just little clear plastic trays that you keep changing every week or every 10 days that very slowly and gently move the teeth. So as long as you have some teeth that are a bit crooked or crowded that you want to sort of straighten, it can be done. But of course, for some really difficult or complex cases, we may not be able to achieve everything that the patient wants to. Yeah. When it comes to a complex case, normally we are talking about a skeletal discrepancy, meaning that the upper and the lower jaw don't match. So normally when the upper and lower jaw matches, once you straighten the teeth will fit together quite well. But in some patients, either the upper jaw or the lower jaw is underdeveloped, it's either too short or too long. And after you straighten the teeth, because the jaws don't match, the teeth don't match. So such cases may not be able to be treated fully by clear aligners or invisalign. For a consultation, of course, we need to take full records. That includes photographs and what we call X-rays or radiographs. Yeah? So X-rays, we're able to show the underlying skeletal structure, and that helps us to actually diagnose the case. So when it comes to what I call medical medicine dentistry, it's very important to get what we call a diagnosis, meaning that what's the condition of the skeletal bones and what's the condition of the teeth conditions. So once we get a diagnosis, we know exactly what's so-called wrong or what's not right with the bite or with the jaw development, then we can then recommend a treatment. So for most cases, usually on the first visit, we can give our patients more or less a rough idea of what needs to be done. Of course, not every case is straightforward or simple. So for some of the more complex cases, we need to take additional records, and then we need to spend some time to sort of go through the photos, go through the models and the X-rays, and we normally see the patient at the second visit for what we call a full consultation. Well, after the second visit, if our patients are keen to actually go ahead, the treatment time, or what we call the runway before the aligner actually comes in, can be between 2 to 4 weeks, depending on the case and also depending on the complexity and whether there are any special requests from the patient as well. Occasionally, it may be up to 6 weeks. The amount of time the aligners need to be worn would also depend on the complexity of the case, because every single aligner moves the teeth roughly about 0.25 millimeters. So the more crooked or the more crowded the teeth, the more we have to move. And the more we have to move, the longer the distance means the more number of trays. So typically, we will tell patients, well, if you compare to fixed braces, the wired type, for most adults, it used to be at least 1.5 years to 2.5 years. Yeah. So for Invisalign, we normally tell them to expect similar timing, but in our experience, many times it's a lot faster. That's partly because with clear aligners, we can sometimes program the teeth movement that we want. So we can actually, what they call, just concentrate on a few teeth instead of doing the whole mouth. And as a result, the treatment time can be customized or can be a bit shorter than if you were to do what we call fixed metal braces. Treatment time really depends on the complexity of the cases. So with clear aligner systems like Invisalign, every aligner can move a tooth roughly about 0.2 to 0.25 millimeters. So the more crowded the case or the more crooked the teeth, the more distance we have to move the teeth, the longer the treatment time will take. So as a rough gauge, using the traditional wired or fixed metal braces, the treatment time is normally about 1.5 years to maybe even 2 years plus if it's a more complex case. So with Invisalign, we normally warn our patients, just be mentally prepared for it to be just as long. But many times we find that with clear aligner systems, we can normally finish the treatment earlier, faster, than traditional metal braces. So, but that may not be the case for every single case. Yeah. Well, I think when it comes to clear aligner or comes to Invisalign treatment, a lot of patients do understand the benefit as compared to the fixed metal braces. Number one, obviously, it's invisible. It can be hardly seen unless you go really up close. Number two, it's really comfortable because there are no metal brackets, no ceramic sharp brackets, no wires to be sort of poking the patient. Unlike metal braces as well, they tend to come off sometimes, creating like a semi-emergency. And then point number 4, of course, is they are removable. So sometimes for certain situations, for example, eating, some patients can actually remove the aligners. And the advantage of being able to remove the aligners, of course, is also cleaning. You can brush, you can floss as per normal. So it pretty much dovetails into our patient's lifestyle. So instead of like being a disruption, it actually sort of complements their lifestyle. Our oldest patient was past 70. Yeah, way past 70. So as long as you are alive, in the sense that as long as the bone is alive, once you exert a light pressure on teeth, teeth tend to move, you know. So there's really no age limit in terms of treatment, but more importantly would be the health of the mouth. I think it's important to have relatively healthy teeth and healthy gums, and that is what actually limits the treatment rather than the age itself. Minimum age, actually, we usually wait until at least 4 to 6 of the adult teeth are out. So now, for example, there are many brands of clear aligners. So for example, for Invisalign, which is one of the better known brands, they even have a product called Invisalign First, where you can start the treatment for about 6 months on a very young child, just to improve or correct some of the so-called crooked teeth when they're young. And then after that, we wait maybe another 1 or 2 years for the child to develop further, and then they'll continue with the second phase of Invisalign. So children as young as even 6 to 8, we can actually start with clear aligners. I think that's important that we try to diagnose what's causing the crooked teeth. Yeah, so I think most people think that crooked teeth is natural or it's normal, but actually it's not. You know? So if you actually travel to remote part of the world, for example, Nepal or even Indonesia, where the air is clean and the food is natural, you find that everyone has a very nice developed face and actually very straight teeth and a very broad smile. And even when they dig out ancient skulls, 10,000 years and before, all the skulls have very straight, well-formed teeth. Yeah, so the debate is still there, what actually causes crooked teeth. But a lot of times they believe that it's things like environment pollution, the food that we eat, and that's causing lots of like allergies in population. People can't breathe well through the nose. They start to breathe through the mouth, and that actually causes the teeth to be actually crooked.